Hello, my name is Elliot Reed. I'm the founder of the Revitalise Clinic, which provides 800 to 1,000 appointments per month, especially for those who, mostly for those who are in pain and needing help. And the Institute of Osteopathy have asked me to talk about what's so great being an osteopath, or I've asked me what's so great being an osteopath. And to be honest, it's probably one of the easiest questions that I've ever been asked. Now, when I was younger, I was obsessed with the physical capacity and the physical ability of Bruce Lee and Muhammad Ali. And then by the time that I got to say 19 years of age, unfortunately I had already two friends who were my age or a little bit younger die from cancer. So I was stuck with these two parameters. I understood what the body can achieve when it's functioning at full capacity, but I also saw what the body can succumb to, or we can succumb to, when our body isn't functioning as well as possible. And on a day-to-day basis, I see a lot of individuals whose, let's say, if their life or if their health is their vehicle, it's not getting them to where they want it to be, right? So they can't wrestle with the physicality of life, they can't pick up their children, they can't go for their normal run or walk, or they can't sleep, for example, because they're in so much pain. And that's always quite common with a variety of different conditions. And it's been, for me as an osteopath, an absolute pleasure to help so many people get the most from that vehicle, which is their health. So we see people who have not just pain, but pain in the context of a vast variety of different conditions, whether that is depression or high cholesterol, high blood pressure, stress, mental illness, diabetes, colitis, all these kinds of things. And it's our role as a practitioner not just to get them as healthy as they can be to achieve their goals, but also to navigate them throughout their journey. So to navigate them throughout sleep deprivation, to improve their sleep, throughout their poor diet, to improve their health, improve their diet, so their body has a better fighting chance to tackle the levels of inflammation and pain that they're experiencing on a day-to-day basis. Now, yeah, obviously, on the surface, this will look like advice, consultations, and rehabilitation advice after a diagnosis, exercise advice after a diagnosis, and obviously treatment. But then we go a bit deeper than that. As osteopaths, we look at things from the round rather than just the injury itself. And the second part I wanted to talk about is just how us as osteopaths, we use a philosophy, osteopathy, and also the osteopathic principles to improve people's health. But at the same time, these osteopathic principles, if they were applied especially to the Western world, would hugely improve the health of the Western world in general. There's many of us, most of us in the Western world, so the Americas or North America and Western Europe, are suffering from conditions that we have brought onto ourselves, whether that is chronic stress from our vocation, whether that is our sleep deprivation, our poor diets, all of which increase our inflammation, and our lack of exercise, which reduces our capacity and increases our inflammation. Osteopathic philosophy or principles are that the body has its own medicine chest and has the capacity to heal itself, but also that the body is a unity of mind, body and spirit. So like I said, we tend to look at things from the round rather than specifically, and what this enables us to do is to help patients in the round rather than just the tissue causing symptoms, which then once again alludes to what we've just discussed. How can we put that pain in the context of that patient's depression and sleep deprivation or stress or lack of motivation? And it's really, as what I enjoy about being an osteopath is being the guide on that journey and guiding that patient through that journey to achieve absolutely unbelievable transformations to their health. We've had a lot of patients who have avoided joint replacement surgery, for example, knee replacement surgery, who have been able to come off their diabetic medication because we've been able to advise them on their diet adequately. So patients who have been able to rebuild their zest for life, and now they can go out and do so many enjoyable things that they don't have to take their medication for depression anymore. And all these things just make the day so rewarding. None of us, I personally have never ever dreaded going to work, because you're seeing so many people and helping them to fix so many complicated challenges and help them to see clear through such complications and help them to just live the life that they want. And I am incredibly grateful to osteopathy for giving me the opportunity to do that. So in short, if you're thinking about studying osteopathy, I would very much advise that you do so. Obviously, research it, observe, go to the universities, ask questions, but you'll find that it is an incredibly rewarding career to be an osteopath.